Thank you for watching this training on lung cancer facts and impacts presented by UMGCCC. In today's session, we're going to go over what lung cancer is, lung anatomy, symptoms, diagnosis, who lung cancer affects, prevention and risk factors for lung cancer screening, and a topic that's very relevant to lung health, vaping. We'll also wrap up with a summary and give you some key takeaways. First, it's important to note that the impact of lung cancer cannot be understated. Lung cancer is the leading cause of cancer deaths. Every year, about 200,000 people are diagnosed with lung cancer, and about 150,000 people die. It is the most deadly form of cancer. Cigarette smoking is the #1 cause of lung cancer. It is linked to 80 to 90% of all lung cancer cases. So what is lung cancer? There are two main types of lung cancer. And like other cancers, lung cancer begins when a cell mutates and grows out of control, forming a tumor. Lung cancer begins in the lungs, but may spread to lymph nodes or other organs like the brain. The two types of lung cancer are small cell and non-small cell. Small cell lung cancer grows and spreads very rapidly and is almost always associated with cigarette use. And by that, we mean that it is almost always the case that a person with small cell lung cancer has smoked or is currently smoking cigarettes. Non-small cell lung cancer grows and spreads slower and makes up the majority of lung cancer cases, about 80%. The lungs have two main functions. Your lungs are two sponge-like organs in your chest. Your right lung has 3 sections called lobes. Your left lung has 2 of those lobes. The left lung is smaller because the heart takes up more room on that side of the body. When you breathe in, air enters through your mouth or nose and goes into your lungs through the trachea, the windpipe. The trachea divides into tubes called bronchi, which then enter the lungs and divide into smaller bronchi. These divide to form smaller branches called bronchioles. At the end of the bronchioles are tiny air sacs known as alveoli. The alveoli absorb oxygen into your blood from the inhaled air and remove carbon dioxide from the blood when you exhale. Taking in oxygen and getting rid of carbon dioxide are your lungs' two main functions. Lung cancers typically start in the cells lining the bronchi and parts of the lungs such as the bronchioles or alveoli, so the smaller parts of the lungs. Lung cancer is formally diagnosed by a biopsy. Symptoms and the results of certain tests may strongly suggest that a person has lung cancer, but the actual diagnosis is made by looking at lung cells in the lab. The cells can be taken from lung secretions, like mucus that you cough up from your lungs, fluid removed from the area around the lungs, or from a suspicious area using a needle or surgery. The choice of which test to use depends on the situation, and you should talk to your doctor to see what they recommend. Most lung cancers do not cause any symptoms until they have spread. But some people with early lung cancer do have symptoms. Most of these symptoms are more likely to be caused by something other than lung cancer. But still, if you have any of these problems, it's important to see your doctor right away so the cause can be found and treated if needed.
Some of the symptoms of lung cancer include coughing up blood, an unexplained cough, symptoms of pneumonia that's not going away, shortness of breath or shortness of breath with exertion that can't be explained, and possibly back or shoulder pain and unexplained weight loss.
Did you know video series? lung and bronchus cancer. Did you know that lung cancer is the leading cause of cancer death for both men and women in the United States? From 2009 to 2013, lung cancer caused more deaths than breast, prostate, colorectal, and liver cancers combined. In 2016, lung cancer diagnoses represented 13% of all new cancer cases in the U.S. This means that out of 100 people diagnosed with any type of cancer, 13 had lung cancer. There are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. Each type is named for the kinds of cells found in the cancer and how they look under a microscope. The cancer cells of each type grow and spread in different ways. The rates of new cases and deaths from lung cancer closely follow smoking rates. Between 1975 and 2013, diagnoses and deaths increased as smoking rates increased, and then decreased as smoking rates decreased. Smoking is the single most important risk factor for lung cancer. Quitting smoking greatly reduces but does not eliminate your risk of developing lung cancer. Lung cancer can also occur in people who have never smoked. Other risk factors for lung cancer include HIV infection, family history of lung cancer, and exposure to secondhand smoke, radon, asbestos, arsenic, chromium, nickel, soot, tar, radiation, or air pollution. The overall 5-year survival rate for lung and bronchus cancer is about 18%. This means that after adjusting for other causes of death, out of 100 people diagnosed with lung cancer, 18 had not died from this cancer in the 5 years since diagnosis. Survival is higher in patients with lung cancer that is detected before it has spread to other parts of the body. The U.S. Preventive Services Task Force recommends that adults who are at high risk for lung cancer get screened regularly. Talk with your doctor, especially if you have any of the following symptoms: cough that doesn't go away, gets worse over time, or produces bloody mucus, chest discomfort or pain, loss of appetite, or trouble breathing or swallowing. Quitting smoking is the most important step you can take to reduce your risk for lung cancer. With the right help, you can succeed. Visit smokefree.gov or call 1-800-44-QUIT for evidence-based tools, articles, and resources. Whether you choose an app, text message program, or online or telephone counseling with experienced quit counselors, smokefree.gov provides access to free, professional support to help you become and stay smoke-free. It's never too late to quit. No matter how much or how long you have smoked, there are benefits to quitting. Take the first step today. Researchers have developed FDA-approved genomic tests that help clinicians match lung cancer patients with specific treatment options based on which molecular changes their cancer has. This new approach to treatment that targets specific tumor characteristics is known as precision medicine. For more information about lung cancer treatment options, including current clinical trials, please visit cancer.gov or call 1-800-4-CANCER. For additional cancer statistics, visit seer.cancer.gov. U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute. Produced October 2017.
More than 90% of all new lung cancer cases are diagnosed in people older than 55. Men are at a higher risk of developing lung cancer than women, and African Americans are in the highest risk group of developing lung cancer. To prevent new cancers from starting, scientists look at risk factors and protective factors. Anything that increases your chance of developing cancer is called a cancer risk factor. Anything that decreases your chance of developing cancer is called a cancer protective factor. Screening is looking for cancer before a person has any symptoms. This can help find cancer at an early stage. When abnormal tissue or cancer is found early, it may be easier to treat. By the time symptoms appear, cancer may have begun to spread already. Adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years are recommended to get an annual screening for lung cancer.
You quit smoking and thought, that's that. But here's the thing about lung cancer. By the time you see the symptoms, it could be too late. But now, there's a new scan that can detect lung cancer early, when it's more curable. If you smoked, get scanned. Talk to your doctor or learn more at savedbythescan.org.
The American Lung Association reports that 27.5% of high schoolers used e-cigarettes in the last 30 days in 2019. That's over 5 million kids. Over 1 million reported daily use. Juul was their go-to brand. Over 10 million adults reported using e-cigarettes in 2018, according to CDC National Health Interview Survey from 2014 to 2018. E-cigarette use is on the rise and is touted as better than tobacco products. However, the evidence does not show that.
Some say e-cigarettes aren't dangerous,
But science shows nicotine can harm teens' developing brains.
no matter how they're exposed.
Let's do an experiment to find out.
Here's a teen who won't be using e-cigarettes.
Now we need one willing to risk their brain development.
Anyone care to volunteer your kid?
Anyone?
I'm Dr. Vivek Murthy, U.S. Surgeon General. Your kids are not an experiment. Protect them from e-cigarettes.
The key takeaways from this session is that lung cancer is abnormal cell growth that turns into a tumor. The lung's main function is to take in oxygen and expel carbon dioxide from the body. Symptoms of lung cancer include a cough that does not go away, coughing up blood or rust-colored phlegm, chest pain that is often worse with deep breathing, coughing, or laughing, hoarseness, loss of appetite, shortness of breath or wheezing, feeling tired or weak, and infections that don't go away. Lung cancer is diagnosed by a biopsy. Adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or who have quit within the past 15 years should talk to their doctor about screening. Cigarette use is by far the #1 most common cause of lung cancer. Vaping can lead to lung complications. The research shows that vaping is harmful to your lungs.